Don't betray yourself, because if you betray yourself, eventually there's something inside of you that will start cooking. Spot on insight from my guest, Dr. Maria Colon-Gonzalez. Sometimes saying no is easier said than done, right? In theory, I know what to do, but sometimes I just feel guilty or obligated to say yes. And not standing firm with boundaries is a blow to self-care, too. Listen in as I sit down to discuss boundaries and self-care in today's episode. Discover key insights about how being a woman changes your approach to boundaries, how to manage guilt over saying no to a patient, negotiating with colleagues who want more from you, and defining self-care on your own terms, not what society dictates. I promise you, Dr. Maria dives deep into these topics. Find the full transcript and more resources for physician moms on inspiredmommds.com/41. You're listening to Inspired Mom MDs with host Cindy Van Prague, helping physician moms take back control and prioritize what matters most so they thrive in private practice and at home. Hi there, and thank you for joining me today. Dr. Maria Colon-Gonzalez is my guest. Before I roll tape on our discussion, here is some background. Dr. Maria founded Salud Revisited, an integrative and lifestyle medicine practice in the Houston, Texas area. While in residency, Dr. Maria realized the many missing links in the care she provided to her patients. She noticed patients would visit the office for medication refills, but not necessarily live healthier. After 4 years in practice, she completed her training in lifestyle medicine. Then she retrained as a yoga instructor. She also trained in culinary medicine and plant-based nutrition. In 2021, she started her integrative medicine fellowship since she believes patients deserve holistic care. She is also a trauma-informed physician, recognizing that the events of harm to one's life have effects on the body, mind, and spirit. Her approach to care is, your body tells a story and you can rewrite the narrative. Hi, everyone, and thank you for joining us today. I have a very special guest. Her name is Dr. Maria Colon-Gonzalez, and she is out of Texas. I got to meet her. She's in my hometown. She is an integrative and lifestyle medicine physician, and I just read some information about her in my intro, but other things that I find fascinating is that she has a podcast just like this. It's called Beyond Medicine, Humanized Care for Women of Influence. She has a book called Healing the Wounds of Medicine, Stories and Journaling for Physicians. And she has her own practice, which is a functional integrative medicine practice for women and teenage girls. So to get started, tell us a little more about yourself, your passion for medicine, and your focus on women and teenage girls.
Yes, thank you. And thank you for having me here, Cindy. So my passion for medicine, I think that started very early on, a combination of different things. So I do have family members that are physicians, and they're not mom and dad. So I didn't grow up with them specifically in my home, yet especially my maternal grandfather, I had heard a lot of stories from my mom of him attending to his own patients at his home. And he actually, before dying, he tried to build the hospital for this little small town in Puerto Rico. Mm. So he has a legacy. And maybe not now, but growing up, when I would go to the town, which is Colon-Gonzalez, everybody would be like, "Oh, you are the granddaughter of," and they would say his name. So there was something of the stories of hearing him serve people, and not only serve people, but the relationship was very different because it was more relatable. I think that sometimes, perhaps when you are in a bigger city or in a bigger health system, the relationship becomes a transactional than the personal type of relationship where, hey, my patients know where I live and that is okay. And if they want to bring me some chicken for Christmas or whatever it is, that is okay. I mean, even to the point where now we even have regulations in terms of can we accept gifts and what we can cannot accept.
Mhm.
Relationship that I heard was very, very different.
Mhm.
And I think that as I'm establishing my practice, even that my patients do not know necessarily where I live and come to my home to give me chickens, I am trying to establish and trying to foster a more personal way of relating to my patients because I really believe that we have lost that. And why my passion for men and why my passion for like teenage girls? Well, at home we're three girls, and I think that growing up with women in a family of all girls, that by itself has made an impact. But also the reality that women as itself, we have perhaps suffered from, I'm not going to use the word discrimination, but just challenges that
Mhm.
we have to overcome as we have entered career world, as we have transition into what some people say like the more masculine roles, which again, that has been given by culture.
Mhm.
And then finally, um, when I was in academic medicine, I was actually in charge of the module that was related with hormones and female health. And the reality is that in a way, hormonally, women are much more complex. And
Mhm.
sometimes in that complexity, there is a lot that can be misguided or even dismissed by health professionals.
Mhm.
And that is why I'm passionate about helping women and empowering women. And the earlier, the better.
Amen to that. Yes, I agree. Discrimination is not quite the right word, but yes, we have an extra tall mountain to climb as women. I agree. And as a woman who helps other people like you and other women physicians, um, there's, definitely a rewarding aspect to that, right? But and I think that women naturally give more to their patients. And some studies have shown that I'm not saying women are better physicians, but they have a different type of interaction with their patients. And it's possible they may give more. And that leads me into our first topic of today. Um, Actually, I didn't introduce that, but we're going to talk about boundaries and self-care. But the first topic of boundaries I think is particularly relevant to women physicians. What, in your opinion, what are some common challenges that women in these helping profession like healthcare and as a physician face?
Yes, I think that. So one, the time, because we want to provide excellent care, because we want to give more, because we tend to be better also at communicating, at listening. That by itself might put us in a position where then you might be running behind and seeing the patient or putting your notes in, doing your work. And it's not because you're less effective, it's
Mhm.
just because since females tend to have different communication strengths,
Mhm.
and it's not, I'm not saying that we're superior or better, but just
Right.
different. That by itself can put us then in this position of like, how do I manage my time and where do I cut it?
Okay.
I also feel, and this goes a little bit into the difference of how we can be perceived, and at least that has been my experience. As a woman physician, I do have to, with male patients, a lot of the times, present myself as much more authoritative,
Mhm.
much more of a distance. Because for whatever reason, I can be seen more as a nurse because that's more of a female role, the nurse rather than the physician.
Mhm.
Um, they can use words as like honey, sweetie, daughter, all of these other things that they probably would not be using if it was another male physician. And I
Mhm.
think that is an area where there has to be this boundary, at least
Mhm.
me, that I have put, where not only do I try to interact in a more authoritative way, but if they say those words or use those words, one, I'm not going to laugh at it, right? I don't try to say that it's okay. And if it's very uncomfortable, I remember one time that I told my office manager, you need to talk to this patient because this is like not, this is a boundary that is starting to get cut. And I
Mhm.
think that that's also very important. And I might be wrong, but I think that those, in terms of interacting in a way that we are perceived with the same knowledge and authority as a male colleague doing the same work. And then definitely our own time management, and not because we want to be more efficient, but
Mhm.
I think that should protect our time because also the majority of the female physicians, then they have a life after work, whether that is kids, family, partner, whatever your social life is, whatever your life
Mhm.
is, it can look different. But I think that you want to protect it because of that, because you want to be able to have life outside the
Mhm.
clinic.
Right. Right. So I'm hearing that you're saying women have a different communication style. And because of that, some women need to alter their approach to talking specifically to male patients um, to fight the perception that, as a female, they don't know it well enough or they're not of a same status. So it's almost like, I don't know, would you say compensation is a word? Are you compensating for how women are perceived?
Yes, I think that definitely, and I think that in my case, I'm I'm very petite. That by itself, right? I mean, there is a difference even in your physical persona that
Mhm.
when you enter the room versus if you're tall, big, that by itself speaks.
Sure.
So I think that in my case, is specifically yes, right? Is and not only compensating, but also keeping this distance because for me, respect is very important. And if I
Mhm.
have a patient, whether it is male or female, that the interaction is not one of respect, that I do not feel respected by them, I know that that is not a physician-patient relationship that is going to continue long term. I just
Right.
yeah. So it's also so that there is the respect that I think that I deserve.
You do deserve that. Absolutely. And it sounds like you are nipping it in the bud. You're catching it early. You're when you first notice signs of disrespect or them replying with, of course, it's obvious to hear a honey, you jump on it and draw that boundary right then and there.
Yeah.
Now,
It's like the
yeah,
warning sign.
yeah, it's like time, spring into action.
Yeah. Red flag.
Now, what about something that's not so obvious? And what about just maybe time you spend with patients, or if someone wants to call you after hours? And what about that feeling of that gray area and that feeling of guilt that some, not saying you do, but some physicians have about not being available for their patients? And how do they handle that fear of rejection or that guilt that they have over drawing boundaries in those softer situations that aren't so obvious?
Right. So I think that the first thing that you should do is examine is this guilt because you're being negligent to
Mm,
the patient? Or is this coming maybe from what culture has told you that you should be as a physician?
mhm,
Medical school residency training where you do not sleep because the patient comes first, for example? Or is it coming from a place of shame? Because
mm,
if it's, depending on where it's coming from, I think that you need to deal with it in very different ways.
mhm,
And I think that if it comes from what culture has told you that you should be as a physician, it's really starting to retell then a different story. It's starting to, change that thought process. It's starting to play with, okay, well, what if I just close, just to give you an example, I close my computer at 7 p.m. and
Mhm.
whatever comes after that,
Yeah.
is that going to start to give me anxiety and not let me sleep at night? So let me try that. Let me see how that works. Let me see how the patients react,
Mhm.
right? I think that also communicating it to the patients, like yesterday I had a patient that messaged me and I told them I start seeing my patients at 11:30 in the morning.
Mhm.
Um, and I was like, you can message me whenever it is convenient for you. Yet I don't start seeing patients until 11:30 in the morning. Um, they can message me at the time that is convenient for them. And sometimes that has been after midnight. Yet I have an automated response and it tells you until, what are the hours that I will respond to you. So again, I'm setting those expectations. I think that sometimes if we do not communicate that, then that's where the relationship starts to get gray. And
Mhm.
especially if you have some say and control in what is going to be those expectations, as in
Mhm.
any relationship.
Right.
Um, if it's coming from this place of I'm feeling guilty, I think that then it's going deeper. I feel
Mm.
like you're feeling guilty because then they say something that you're not a good doctor. So then how do you define being a good physician? And are you going to define it as maybe how society does? Again, your RVUs, your Priscani scores, all of those things. Or do you want to define it in your own terms? And
Mhm.
right, and you have to start to like play with the mind, right? And then the other thing is really look at, so are you being negligent, right? And
Mhm.
what I mean by that is I remember a patient that she messaged me, it was not that late, maybe 8 p.m. And she was afraid that she was having very, very low blood sugar levels. And when I saw the message that it was, because I did see what the message was at that
Mhm.
time of the evening, to her in particular, because of what it was, I told her, for something like this, I prefer that, yes, I'm going to answer to you. And I want you to tell me if you check your blood sugar level and it's beyond this. So I messaged her and I told her, if your blood sugar level is lower than this, please give me a call.
Mhm.
And so I think that also knowing that boundaries do not have to be rigid. They can be
Mhm.
flexible. And then
Mhm.
you decide how you move between them. And that's the beauty of it. And finally, if it comes from a place of shame, I think that then there you really need, whether it is a coach, mental health provider, this is not that you're crazy, this is not that there's a problem, but shame is a very strong emotion. And when there is shame, you need somebody else that can start to attune and mirror to you, or a really, 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 really good friend, safe friend. But you need
Mhm.
you need somebody else if there
Right.
is change. It's not only your mind. There's also something about the feeling and the emotion and the who that needs seeing and attuning.
Mm. I love how you broke down your answer into three or four categories of what guilt is a big topic. So essentially, just to mirror back to you, so you can ask yourself, am I feeling guilty out of some kind of neglect, or am I doing something that's not right for my patient? You can view it from the lens of, um, do I feel guilty just because society told me that I should be doing this? Or do I feel guilty finally because I feel shame? And that involves some deeper work, of course. And I also loved that you talked about communicating your boundaries with your patients, and that it can be fluid, and that you can allow, they don't have to be so rigid. You can allow, for example, your patient, you don't want them to get hypoglycemic because you're like, well, I refuse to see anybody. I mean, you're not, being irresponsible. That sounds
Exactly.
so reasonable. So reasonable. So one more aspect of boundaries I wanted to ask you about is that in a different, taking you out of those situations, let's say it's a work situation, maybe it's with administration or with some coworkers, or maybe you have a partner in your practice, and they're asking you to do something that doesn't sit right, but you just have a hard time saying no. It's just hard to say no. It's hard to let people down. What advice would you give to someone who has that issue?
Wow. It's a good question. And I'm going to be very honest.
Mhm.
Depending on what it is, I don't have a hard time saying no. I'll be
Mhm.
very honest.
Mhm.
On the contrary, I think that because sometimes I have said no in situations where the person asking is somebody in a position of authority, like my residency program director.
Yeah.
So the situation was I was asked to use a diagnosis code that the patient just didn't have that diagnosis code. Let's leave it at that.
Yeah.
Um, and when if it's somebody in a position of authority, and even if you say no, what I has been my experience is that you need to be ready for retaliation, unfortunately. So I think that one is ask yourself what is it that what so what is the situation, right? I think that sometimes you do have to keep your no, even thought if that might um, cost you something because you want to put your values first.
Right.
And that is going to be at the end, long term, more important. Let's say that it's something more simple. For example, a colleague that was placed to be on call, like now for Christmas, um, last minute they realized, like, oh my God, I got put on call and I already was going, I don't know, to Europe with my family members.
Right.
And they ask you, hey, can you cover for me? And it's last minute. I think that in that situation, what I would look at is, okay, so what is this going to cost me if I say yes? And is that a cost that I'm willing to like live for? And then not only that, then is, okay, so this is going to cost me something. Can we negotiate something that I can get in return? I think that those are very, very easy. Um, again, putting your values first, because maybe for you, it is a big value that, I don't know, in Christmas morning, you want to open up the gifts with your kids. Maybe for you, that's really, really important. And if that's more important than saying yes to a colleague, then don't betray yourself. Because if you betray yourself, eventually there's something inside of you that will start cooking. So we never want to betray ourselves and who we are.
Mm. Oh, that's fabulous. Because, my first instinct for some situations would be, I don't like conflict. It's so much easier just to say yes and just go with it and just deal with it. But I too fully, like, my whole body gets this energy. Of course, your values come first. And I like the fact that you're reinforcing what's so true and what's hard to follow. You can know it, you can know that you should follow your values first, but it doesn't mean your body's going to feel that way in the moment. Your body may be, oh, I just don't want conflict. But yes, you're right. You need to step out and negotiate too. Values first, and you can negotiate. If you say yes, it doesn't mean that they can't give you something back in return.
Yes. And I think that also, taking into consideration, I mean, look at the big picture. Is this somebody that is known to do this over and over and over?
Sure.
Right.
True.
The other
Yeah.
thing is thinking of, well, it's also, you need to think, if I'm all the time saying no to all of my colleagues, eventually I might need something, right?
Hmm.
So you have to, again, that like flexibility, I think that is very important. And then finally, also, this can play into, again, your value system. Let's say that the person asking for, hey, can you cover for me? They just have like a family emergency. Like, for
Yeah.
example, my parents are in Puerto Rico and something happens. I always have to like turn the world around to go there.
Yeah.
So that, I think that also makes a difference, because in my value system, this helping the other is also like very important.
Mhm.
So I think that you also, I just want to add, you also want to look at the entire picture and the entire story, putting your values first without self-betraying.
Right. Do not betray yourself, like you said. Right. So I'd like to transition a little bit to a second um, area to discuss, which is self-care. But it's actually kind of the same thing, because self-care is also setting boundaries, in my opinion. But just the term self-care, I think, has this stigma. Gosh, when people say self-care, they think, oh, you want to go get a manicure. What, it means so many different things to different people. Some of them very positive, like for me, some of them very, very negative and very stigmatized. So how would you define self-care, and why is it so important for healthcare professionals, physician moms?
Yes. So without going necessarily into a big discussion on religion, I'm just going to say you have to love yourself first before being able to love others. And I think that that applies to self-care. And that's one of the reasons why I start seeing patients like later in the day, because it's not that I'm sleeping in until 10 in the morning. Mm-mm. It's because in the morning, I'm taking care, again, aligned with my values. My dog, cooking my breakfast, I'm exercising, I'm looking at my schedule, I'm doing my journaling, I'm doing my Reiki, I'm doing all of these other things that in a way are going to position me to be a better physician, to be in a better mindset when I sit down and then start seeing the patients. So for me, self-care can look like, yes, I take some time of rest where I have somebody else serve me, whether that is I go to a restaurant or I take a massage or, a facial, but not because the self-care is the massage, but rather because that is a space where then I can disconnect. I'm not with my computer, I'm not with my
Mm.
laptop. I am resting and I am allowing somebody else to serve me. It is very important that so you serve, but that you allow others to serve you. I think that also for me, self-care can look as doing something that I enjoy, like reading, hiking, exercising, cooking. So those are other things that feed my soul. So what are the things that you are doing to feed your soul that you like, that you enjoy? And most of all, for me also, self-care I have learned a lot that is having some space time where I can do some journaling, awareness, introspection, self-examination. In not self-examination because you need to perfect yourself, because I
Mhm.
think that sometimes when we talk about self-examination, people are thinking, well, is something is wrong with you, you're not good enough, you're trying to perfect yourself. I think that this self-examination can even be, how are you doing today?
Mhm.
Instead of the regular, oh, I'm okay. Well, how are you truly doing today?
Mhm.
Um, and that for me is what self-care can look like.
Right. So you are putting your values and yourself first at the beginning of the day, positioning yourself to be a better doctor for the rest of the day. And
Mhm.
wow, I really love how you say that we as physicians spend so much time serving other people, or as moms, as sisters, as daughters, like you said, serving all people in our lives. How many times can you count on one hand how many times someone has served you? And
Mhm.
and I know you can, because you prioritize that. And I think that's a beautiful takeaway. Yeah.
Mhm.
Yeah.
however
So
that looks.
however that looks for you, right? And whatever time of day, not that they have to do that first thing of the day. Um, so so what you're doing is you are prioritizing yourself. How can we inspire other people to do the same thing? How can we prioritize the listener? I'm sorry, how can we inspire the listeners to prioritize themselves? Like what's some small steps that they can do to kind of get towards where you are? Not that they're trying to model you, but just try to get to that state that you're in.
Yeah. So I think that, again, starting with introspection and awareness.
Okay.
So, why is it that you need to prioritize yourself? Why is it that you need self care, or how you want to word it?
Mhm.
Because I think that, like Simon Sinek says, if you start with the why, you have a greater hold as to why is it that you're doing this, right? The purpose. So start there. And then I would say examine, know what your values are,
Mhm.
and then know what type of life you want to try to create. So for me, a lot of what I create is countercultural. Think about it. A lot of people wake up to have coffee while they're checking their email.
Yeah.
So
Yeah.
I am a little bit countercultural. And this is not necessarily something that everybody, one, wants to do, or two, that being countercultural also comes with a price. So this is something that maybe you don't even want to do because you don't want to pay that price.
Mhm.
But again, independently of how you choose that this is going to look for you, can you align it with your values? Can you align it with the type of life that you're going to create? So, are the decisions that you're making today taking you closer to where you want to be? So, for example, in my stage, I'm making decisions so that I can build my practice. And those are decisions in a lot of other areas, but it is because of where I want to be.
Yeah.
Rather, if you're making your decisions just based on the present and on the rush and the reacting rather than the responding, then that's when you can start to get into like problems.
Yeah.
So I think starting with this awareness, introspection, who you are, what are your values, where do you want to go in life, what are the decisions that you want to make so that you can get there. And then knowing yourself. You might not
Mhm.
be a morning person. You might not like to exercise in the morning. You might prefer to
Mhm.
do it after you do everything because then you take that off of your mind.
Yeah.
So know yourself and honor who you are without culture and the noise of social media telling you who you need to be.
Right. Right. It's not a quick, here's three tips, here's three tricks, and then you're going to arrive at self-care. It's about self-reflection and values.
Yes.
Yeah. Very, very well said. In the last few minutes, I just want you to give you a chance to just kind of explain how people can reach out to you. How can they work with you? What if they're interested in, coming to you as a physician? And tell us more about how they can reach you, what you offer. Go for it.
Yes. So they can reach me. The easiest probably way would be through my website. So
Okay.
www.salud in Spanish, which is
Mhm.
SALUD revisited,
Mhm.
REVISITED.com. I love working, as I said, with women as well as with teenage girls, whether I'm working with both of you. So if you have like a daughter, or maybe you are coming by yourself,
Mhm.
that is completely okay. My areas of passion is to help women really heal their metabolic health and hormonal health that go together. I am very passionate also about mental wellness.
Mhm.
And my approach to care is optimizing everything that is lifestyle, which goes beyond diet and exercise. Then I might use some supplements, nutraceuticals. I do medical acupuncture as well. So if you are somebody that are looking for a way to optimize your health and help your body heal from the inside out, you are a perfect fit for me.
Mm-hmm.
I see patients in the state of Texas virtually, of course, not for the acupuncture, and then in person in Houston, in the Houston Heights area. And then I also use regular medications, multiple reasons. Perhaps you need them. Or two, you are in a stage where you are like, I don't know about the needles and I don't know about the supplements. And I completely respect that as long as we can always optimize that lifestyle, which again is the foundation of health.
Yeah, beautiful. And of course, I will list the link to your website in the show notes today. And I'd like to just throw in, if it's okay, a link to your podcast and where they can find your book, which is on journaling, which looks fascinating. And anything else you throw my way, I will put it there so people can find it later.
Yes,
So,
yes.
yeah.
No, I was just going to say the book can be found in Amazon, and then
Okay.
the podcast, wherever you listen to podcasts, I do it bi-weekly. And if you are a female physician and anything that we spoke about also is in your areas of like topics, and you want to reach out to me just to be in the podcast, you can also do that.
Oh, yay. Wonderful. Thank you so much for being my guest today. It was
Thank
such a pleasure.
you. Yes. Until next time. Bye.
Bye. Thank you for tuning in to Inspired Mom MDs. Please share with other physician moms and leave a review if you found value from this podcast.